Hi, I'm Rakia. This infection control education series is produced under the guidance of the Taiwan Medical Mission. Today's topic is the chain of infection, understanding how infections spread and how we can stop them. Let's get started. Infection occurs only when every link in the chain is intact: infectious agent, reservoir, portal of exit, mode of transmission, portal of entry, and susceptible host. Break just one link, and transmission is stopped. The chain of infection consists of 6 key components: infectious agent, the microorganism that causes disease; reservoir, where the pathogen lives, such as humans, animals, or the environment; portal of exit, how the pathogen leaves the host, such as through droplets, blood, or feces; mode of transmission, how the infection spreads, including airborne transmission, direct contact, or vectors, e.g., mosquitoes; portal of entry, how the pathogen enters a new host, such as through mucous membranes or open wounds; susceptible host, a person at risk of infection, such as those with weakened immunity or without vaccination. Here are some examples. SARS-CoV-2 spreads through respiratory droplets from infected individuals. It is transmitted via airborne particles or contact with contaminated surfaces, entering the body through the eyes, nose, or mouth. Unvaccinated individuals, the elderly, and immunocompromised people are at higher risk. MRSA spreads through direct contact with infected wounds or contaminated surfaces, often via the hands of healthcare workers. It enters the body through surgical wounds, catheters, or broken skin. Hospitalized patients and individuals with weakened immune systems are at higher risk. Salmonella is transmitted through the consumption of contaminated raw meat, eggs, or unpasteurized milk. The bacteria exit the body through the feces of infected humans or animals and enter new hosts via the digestive tract. Anyone can be affected, but infants, the elderly, and immunocompromised individuals are at higher risk. HIV is transmitted through the blood, semen, vaginal or rectal fluids of an infected person. It spreads primarily through unprotected sex, sharing needles, mother-to-child transmission, or contaminated blood transfusion. The virus enters the body through mucous membranes or directly into the bloodstream. Susceptible individuals include those engaging in unprotected sex, people who share needles, and newborns of HIV-positive mothers. Dengue virus is transmitted through the bite of infected Aedes mosquitoes, which acquire the virus from infected humans. The virus exits through the mosquito's saliva and enters the human body through the skin during a bite. People in dengue endemic areas are at higher risk. Breaking the chain of transmission depends on the mode of transmission and the characteristics of the disease. For example, getting the COVID-19 vaccine to build immunity, wearing a mask to prevent inhaling virus-containing droplets, maintaining hand hygiene to block contact transmission, and avoiding needle stick injuries to prevent bloodborne infections. The chain of infection shows how diseases spread. Breaking any link stops infection.